cholangiocarcinoma.
Thank you, Susan. It's a privilege to be here today to participate in this discussion. Before I start, I have one conflict to disclose. I'm one of several founders of Image Guidance liver surgery company. I'm not going to discuss this as part of the discussion today. What I want to do in the next few minutes is touch on some of the areas that I think are controversial about the role of transplantation for Hilar cholangiocarcinoma. I think everyone in this room is familiar with some of the areas of debate. I would say, at least in my opinion, transplantation for Hilar cholangiocarcinoma is now should be considered a standard therapy in the carefully selected, appropriately selected patient. But there are a number of areas of controversy. So a big one is how effective is transplantation for de novo disease, in other words, patients who do not have underlying PSC, and how does this compare with hepatic resection? As a corollary, would transplantation be better than resection in patients with potentially resectable disease, or those who are marginally resectable? Have the favorable results that have been seen with transplantation been influenced by having patients who never had cholangiocarcinoma in the first place, who got transplanted? And I'll touch on some of those factors in a few minutes. What are the results for this therapy at non-Mayo centers? It's great to have Chuck Rosen here leading the discussion. I think for many of us, transplantation for Hilar cholangiocarcinoma has been Mayo Clinic leading the way, and then the rest of us trying to get involved. Finally, is there a role for transplantation for patients with intrahepatic cholangiocarcinoma? The